post-traumatic stress disorder (PTSD? Well, it's a mental health condition that is triggered by a terrifying event, either experiencing it or witnessing it. Symptoms may include flashbacks, nightmares, and severe anxiety, as well as uncontrollable thoughts about the event. Most people who go through traumatic events may have temporary difficulty adjusting and coping, but with time and good self care, they usually get better. If the symptoms get worse, last for months or even years, and interferes with your day to day functioning, you may have PTSD. Getting effective treatment after PTSD symptoms develop can be critical to reduce symptoms and improve function. Well, earlier on this channel, I have already uploaded a short video about PTSD. I hope you have already seen it. And today I am going to discuss this illness in detail. Well, first of all, let me tell you the symptoms. Post-traumatic stress disorder symptoms may start within 1 month of a traumatic event, but sometimes symptoms may not appear until years after the event. These symptoms cause significant problems in social or work situations and in relationships. They can also interfere with your ability to go about your normal daily tasks. PTSD symptoms are generally grouped into 4 types. These 4 types are intrusive memories, avoidance, negative changes in thinking and mood, and changes in physical and emotional reactions. Symptoms can vary over time or vary from person to person. Now I will discuss these individual 4 types with you. First of all, I'll tell you about intrusive memories. Symptoms of intrusive memories may include recurrent unwanted distressing memories of the traumatic event, reliving the traumatic event as if it were happening again, flashbacks, upsetting dreams or nightmares about the traumatic event, severe emotional distress or physical reaction to something that reminds you of the traumatic event. Avoidance. Symptoms of avoidance may include trying to avoid thinking or talking about the traumatic event, avoiding places, activities, or people that remind you of the traumatic event. Negative changes in thinking and mood. Symptoms of negative changes in thinking and mood may include negative thoughts about yourself, other people, or the world, hopelessness about the future, memory problems including not remembering important aspects of the traumatic event, difficulty maintaining close relationships, feeling detached from family and friends, lack of interest in activities you once enjoyed, difficulty experiencing positive emotions, feeling emotionally numb. And the last one is changes in physical and emotional reactions. Symptoms of changes in physical and emotional reaction, also called arousal symptoms, may include being easily startled or frightened, always being on guard for danger, self-destructive behavior such as drinking too much or driving too fast, trouble sleeping, trouble concentrating, irritable, angry outbursts or aggressive behavior, overwhelming guilt or shame. For children 6 years old and younger, signs and symptoms may also include reenacting the traumatic event or aspects of the traumatic event through play, frightening dreams that may or may not include aspects of the traumatic event. And I'll tell you about intensity of symptoms. Well, PTSD symptoms can vary in intensity over time. You may have more PTSD symptoms when you are stressed in general, or when you come across reminders of what you went through. For example, you may hear a car backfire and relive combat experiences, or you may see a report on the news about a sexual assault and feel overcome by memories of your own assault. If you have disturbing thoughts and feelings about a traumatic event for more than a month, if they are severe, or if you feel you are having trouble getting your life back under control, you should talk to your doctor or a mental health professional. Getting treatment as soon as possible can help prevent PTSD symptoms from getting worse. If you have suicidal thoughts, if you are someone you know has suicidal thoughts, get help right away through many resources which are available to your country. Reach out to a close friend or loved one. Contact a minister, a spiritual leader, or someone in your faith community. You can also call suicide hotline number in your country. Okay. Also, you should make an appointment with your doctor or a mental health professional. And if you think you may hurt yourself or attempt suicide, you should call your local emergency number immediately. If you know someone who is in danger of attempting suicide or has made a suicide attempt, make sure someone stays with that person to keep him or her safe. Call your local emergency number immediately, or if you can do so safely, take the person to the nearest hospital emergency room. Now I'll tell you about the causes. You can develop post-traumatic stress disorder when you go through, see, or learn about an event involving actual or threatened death, serious injury, or sexual violation. Doctors are not sure why some people get PTSD. As with most mental health problems, PTSD is probably caused by a complex mix of stressful experiences, including the amount and severity of trauma you have gone through in your life, inherited mental health risks such as a family history of anxiety and depression, inherited features of your personality, often called your temperament, the way your brain regulates the chemical and hormones your body releases in response to stress. Now I'll tell you about the risk factors. People of all ages can have post-traumatic stress disorder. However, some factors may make you more likely to develop PTSD after a traumatic event, such as experiencing intense or long-lasting trauma, having experienced other trauma earlier in life, such as childhood abuse, having a job that increases your risk of being exposed to traumatic events, such as military personnel and first responders, having other mental health problems, such as anxiety or depression, having problems with substance misuse, such as excessive drinking or drug use, lacking a good sports system of family and friends, having blood relatives with mental health problems, including anxiety or depression. I mean, these all factors which I have told you can increase the risk of PTSD. Now I'll tell you about the kinds of traumatic events. The most common events leading to development of PTSD include combat exposure, childhood physical abuse, sexual violence, physical assault, being threatened with a weapon, and accident. Many other traumatic events also can lead to PTSD, such as fire, natural disaster, mugging, robbery, plane crash, torture, kidnapping, life-threatening medical diagnosis, terrorist attack, and other extremes or life-threatening events. Now I'll tell you about the complications. Post-traumatic stress disorder can disrupt your whole life, your job, your relationships, your health, and your enjoyment of everyday activities. Having PTSD may also increase your risk of other mental health problems such as depression and anxiety, issues with drugs or alcohol use, eating disorders, suicidal thoughts and actions. And now I'll tell you some preventive measures. After surviving a traumatic event, many people have PTSD-like symptoms at first, such as being unable to stop thinking about what has happened. Fear, anxiety, anger, depression, guilt, all are common reactions to trauma. However, the majority of people exposed to trauma do not develop long-term post-traumatic stress disorder. Getting timely help and support may prevent normal stress reactions from getting worse and developing into PTSD. This may mean turning to your family and friends who will listen and offer comfort. It may mean seeking out a mental health professional for a brief course of therapy. Some people may also find it helpful to turn to their faith community. Support from others also may help prevent you from turning to unhealthy coping methods such as misuse of alcohol or drug. Now I will tell you about the diagnosis of PTSD. Well, when the patient comes to us, we perform a thorough physical exam to check for medical problems that may be causing your symptom. We also do a psychological evaluation that includes the discussion of your signs and symptoms and the events that led up to them. Use the criteria in the Diagnostic and Statistical Manual of Mental Disorder. That is a DSM-5 criteria published by American Psychiatric Association. Diagnosis of PTSD requires exposure to an event that involves actual or possible threat of death, violence, or serious injury. Your exposure can happen in one or more of the ways which I am going to tell you. You directly experience the traumatic event. You witnessed in person the traumatic event occurring to others. You learned someone close to you experienced or was threatened by the traumatic event. You are repeatedly exposed to graphic details of traumatic events. For example, if you are a first responder to the scenes of traumatic events. You may have PTSD if the problem you experience after this exposure continue for more than a month and cause significant problem in your ability to function in social and work setting and negatively impact relationships. Now I'll tell you the treatment. Post-traumatic stress disorder treatment can help you regain a sense of control over your life. The primary treatment is psychotherapy but can also include medication. Combining these treatments can help improve your symptoms by teaching you skills to address your symptoms, helping you think better about yourself, others, and the world, learning ways to cope if any symptom arise again. Treating other problems often related to traumatic experiences such as depression, anxiety, or misuse of alcohol or drugs. Also, you don't have to try to handle the burden of PTSD on your own. Psychotherapy. Several types of psychotherapy, also called talk therapy, may be used to treat children and adults with PTSD. Some types of psychotherapy used in PTSD treatment include cognitive therapy. This type of talk therapy helps you recognize the ways of thinking, cognitive patterns that are keeping you stuck. For example, negative beliefs about yourself and the risk of traumatic things happening again. For PTSD, cognitive therapy often is used along with exposure therapy. Now I'll tell you about exposure therapy. This behavioral therapy helps you safely face both situations and memories that you find frightening so that you can learn to cope with them effectively. Exposure therapy can be particularly helpful for flashbacks and nightmares. One approach uses virtual reality programs that allow you to re-enter the setting in which you experienced trauma. Eye movement desensitization and reprocessing, that is EMDR. EMDR combines exposure therapy with a series of guided eye movements that help you process traumatic memories and change how you react to them. Your therapist can help you develop stress management skills to help you better handle stressful situations and cope with stress in your life. All these approaches can help you gain control of lasting fear after a traumatic event. You and your mental health professional can discuss what type of therapy or combination of therapy may best meet your needs. You may try individual therapy, group therapy, or both. Group therapy or both. Group therapy can offer a way to connect with others going through similar experiences. Now I'll tell you about some medications. Several types of medication can help improve symptoms of PTSD. These are antidepressants. These medications can help symptoms of depression and anxiety. They can also help improve sleep problems and concentration. The selective serotonin reuptake inhibitor, that is SSRI medications, include sertraline, that comes with the name of Zoloft, and paroxetine, that comes with the name of Paxil, are approved by Food and Drug Administration, FDA for PTSD treatment. Anti-anxiety medication. These drugs can relieve severe anxiety and related problems. Some anti-anxiety medication have the potential for abuse, so they are generally used only for a short time. Prazosin. While several studies indicated that prazosin, that is come with the name of Minipress, may reduce or suppress nightmares in some people with PTSD, a more recent study showed no benefit over placebo. But participants in the recent study differed from others in ways that potentially could impact the results. Individuals who are considering prazosin should speak with a doctor to determine whether or not their particular situation might merit a trial of this drug. You and your doctor can work together to figure out the best medication with the fewest side effects for your symptoms and situation. You may see an improvement in your mood and other symptoms within a few weeks. Tell your doctor about any side effects or problem with your medications. You may need to try more than one or a combination of medication, or your doctor may need to adjust your dosage or medication schedule before finding the right fit for you. Now I will tell you about some coping and sports measures. If stress and other problems caused by traumatic event affect your life, you should see your doctor or mental health professional. You can also take actions as you continue with treatment for post-traumatic stress disorder include. These actions include: you should follow your treatment plan. Although it may take a while to feel benefit from therapy or medication, treatment can be effective and most people do recover. Remind yourself that it takes time. Following your treatment plan and routinely communicating with your mental health professional will help move you forward. Learn about PTSD. This knowledge can help you understand what you are feeling, and then you can develop coping strategies to help you respond effectively. For example, this my channel is basically a health related medical education channel, so you can learn so much from this. Okay. Also, you should take care of yourself, get enough rest, eat a healthy diet, exercise, and take time to relax. Try to reduce or avoid caffeine and nicotine, which can worsen anxiety. Do not self-medicate. Turning to alcohol or drugs to numb your feelings is not healthy, even though it may be a tempting way to cope. It can lead to more problems down the road, interferes with effective treatment, and prevent real healing. Break the cycle. When you feel anxious, take a brisk walk or jump into a hobby to refocus. Stay connected. Spend time with supportive and caring people, family, friends, faith leaders, or others. You don't have to talk about what happened if you don't want to. Just sharing time with loved ones can offer healing and comfort. Consider a support group. Ask your mental health professional for help finding a support group, or contact veterans organization or your community social services system, or look for local support groups in an online directory. Well, this was my video about PTSD. I hope you like this video. If you have any question about PTSD, or if you want me to upload a video about any other medical illness, for that video is already not there, you can post in the comment section, and as soon as I find a time, I'll try to upload that upload the video about that particular problem as soon as possible. Thanks a lot for watching this video. See you next video. Bye for now.